Dr. Thomas Seyfried is a biochemical geneticist and a professor of biology at Boston College. His work is related to the metabolic components of cancer cells and to developing better treatment and outcomes for patients of the disease. He has released over 150 peer-reviewed publications and has won several awards from many diverse organizations. He has authored several books, but is most famous for his 2012 book, Cancer as a Metabolic Disease, on the origin, management, and prevention of cancer. He also shares his research freely on many shows and podcasts, and we are so grateful that he took the time to appear with us today on Boundless Body Radio. Dr. Thomas Seyfried, welcome to the show.
Oh, thank you very much, Casey. It's nice to be here.
That's great. It's really quite an honor to host you here. This is a really interesting topic. So my mother was diagnosed with breast cancer back in the late 90s. And I remember at the time, something interesting started to happen in the kitchen and we started eating a little bit differently. And so the white bread all of a sudden was gone and it turned into wheat bread, and we were drinking skim milk and, more fruits and vegetables. And we started to, you could eat as many red vines as you wanted because those were low fat. And lo and behold, the outcome for my mother was really not that great. I mean, the cancer would come and go, she would get radiated and chemotherapy and boy, just years and years of battling until she finally passed in 2006. But it's just so interesting. We followed the advice. We did everything they said to do, and look at the outcome. It's just, it was a terrible amount of suffering and all of those treatments that just take you to the edge of death and back. Like, so crazy.
Yeah, it's really a shame. It's a tragedy. It's actually a tragedy. Unfortunately, it's a real tragedy.
It really is. So let's learn a little bit more about you. Your intro that we read here was greatly abbreviated. You are not somebody who just went to the American Cancer Association, grabbed a pamphlet and learned about this overnight. You've been doing this for a very long time. So tell us a little bit about your background and how you became interested in this topic.
Well, I mean, yeah, you're correct. I've been working on the cancer in different formats for more than 40 years. But I've also worked extensively in the field of epilepsy and in neurodegenerative brain diseases like Tay-Sachs disease, Parkinson's disease, and these kinds of things. Basically, a biologist, a biochemist that then goes into neurobiology, and cancer is basically a composite of all kinds of aspects in biology. So if you understand the tenets of the field, basically evolutionary biology, because nothing in biology makes sense except in the light of evolution, and that goes for cancer biology as well. So you start in these fields and you kind of putz around looking at tumor cells, either growing in culture or growing in a mouse, and you just do things and you look at things that are changing, and something always changes in cancer. And then, we were doing a lot of work with ketogenic diets in epilepsy. Where ketogenic diet actually started was in managing epileptic seizures.
That's right. And
we were trying to figure out how that diet would stop epileptic seizures. But at the same time, we were evaluating, cancer in the lab, and one thing leads to another. We saw that calorie restriction was really significantly reducing cancer cells in mice. And the mechanism seemed to be a reduction of glucose and elevation of ketone bodies. Well, if you're doing a ketogenic diet, it does the same thing. So we started to put ketogenic diets, calorie-restricted ketogenic diets on the mice. And the next thing you know, you get some really significant reduction in tumor growth. And then we were able to link that to all of the major fields of cancer, which is, angiogenesis, dysregulated cell growth. We were able to find and show in no uncertain terms how this worked to stop cancer. We still haven't been able to figure out how the ketogenic diet stops epileptic seizures. That's going to be another century. But figuring out how restriction of glucose and elevation of ketones kills cancer cells there's decades and decades of research that would support that concept. So, one thing leads to another, and the next thing you know, you're on the path to cancer management and resolution.
Interesting. So where are we today? Let's get a quick update. 2021. I mean, we've done some amazing things in this last year. I mean, if you would have gone back to March of 2020 and told me that we would have several viable options for a vaccine for COVID-19, I would have laughed you out of the room. There's no way. And we do. So we're making these really cool advancements in health. Where are we today with cancer?
I think we're nowhere. In fact, a big paper just came out in 2020 by a group showing that of all the new drugs that have been developed since 2000 in the cancer field, the overall survival rate is 2.4 months or 72 days. So this speaks to an abysmal failure in managing cancer, and the reason for that is the reason for that is people the majority of those in the field think it's a genetic disease. So most of the therapies that are being produced to manage cancer are in one way or another linked to the misunderstanding of the origin of cancer as a genetic disease. So consequently, you see all these immunotherapies and all these kinds of big breakthrough. Well, if you consider 2.4 months of extra life a breakthrough, then that's okay. I mean, that if you think that's the way we're going to resolve cancer is just giving people an extra 72 days of life, I think there's something seriously wrong here.
Wow.
So and what I'm telling you is already published. There's a big paper. I can send it to you. It's actually shocking to see how little progress we've made in managing cancer. The death rates go up every year. They're going up. Now I predict that next year, perhaps this is a speculative prediction, that cancer death rates may drop maybe significantly next year. And the reason for that is the COVID is killing the cancer patients before the cancer can kill them. That's one possibility. The other possibility is that people who have a good immune system and have cancer and get COVID, there's some reports now that the COVID will actually cause cancer resolution in some of these people. Can you believe this?
Wow.
Yeah, that's and the other possible explanation. People, because they fear COVID so much, they're not going to get irradiated and taking toxic poisons, and that somewhat protects them. So you avoid toxic assault on your body. People who are being toxically assaulted, their immune system is shot to hell. So when they get COVID, they have a greater risk of dying. So in the end, you might find a big drop in cancer as the indirect effect of COVID. But we don't know that yet. We have to wait, because that would be the first real drop if that happens. Now, of course, when we manage COVID, like you said, with all the new vaccines and things like that, once COVID becomes under control, if we continue on the same path, then you will see an increase in cancer death rates in the next year or 2 years maybe. So because the approach we're using is not based on the origin of the disease, so consequently you don't get major changes in death rates.
Wow, that's staggering. I mean, sometimes I'll tell people like I have found a cure for heart disease, and they'll look at me funny, and I'll say, "Yeah, it's called shoot you in the face." Like, if I shoot you in the face, you're not going to die of a heart attack, but that doesn't necessarily fix the problem. And when you're talking about COVID, especially, and all the things that it associates with, that associates very strongly with cancer as well. All the same diseases that you see, the hypertension, the diabetes, the obesity, all of those same things. I mean, shouldn't that give us a clue of how cancer works?
Well, we know clearly what the origin of cancer is. It's just damage to mitochondrial respiratory system from any variety of things in the environment, which then launches the cell into a fermentation metabolism, which is an ancient pathways by which cells all on the planet lived before oxygen came into the atmosphere. So these cancer cells are doing nothing more than falling back on ancient metabolic pathways that existed, millennia ago, 2.5 billion years ago, let's be honest. And they fuel on two fuels primarily, the sugar glucose and the amino acid glutamine. Those are the two fuels that are driving all cancer, regardless of where it's located. And the solution to the problem is just restricting those two fuels.
If you want to learn how to implement the ketogenic diet and the Press Pulse protocol into your cancer management, just visit school.com/keto for cancer, the new community by our research analyst Johnny Rockermeyer. Within this new community platform, you can connect with other patients and learn from their experiences. You can also just search through the posts other members have already made. You will have access to our classroom section as well, which provides practical advice and tools for the best results. These sections cover all parts of the Press Pulse protocol that you should implement. Starting with the General Scientific Concepts by Dr. Thomas Seyfried, we will show you how to start the ketogenic diet, including which foods to choose and which to avoid. Additionally, we prepared a list of doctors specialized in metabolic therapy, as well as details about glutamine inhibition and hyperbaric oxygen protocols. So, take a look around at school.com/keto for cancer.
It's too simple for people to really embrace conceptually, but the experimental evidence and the science to support what I just said is overwhelming. So one would think, well, if I'm correct, why are we not doing that in all the clinics? Why are we doing what we're doing and not targeting glucose and glutamine? That's the question people have to ask themselves. And if you go to the top medical schools and ask people about what I just said, they would say there's no evidence for that. And obviously, that statement would mean they don't read the scientific literature that supports what I just said, or look at the response of patients that are doing this. Well, you got to have big clinical trials. You see, otherwise people say, I can't believe anything unless I see a big clinical trial. And that's important to state that. But then you say, well, who's going to run the clinical trial to determine if ketogenic metabolic therapy used with some off-target, off-patentable drugs is going to be successful in long-term management and possible resolution of cancer? And the answer is nobody's going to do that. Who's going to pay for that? Who wants to step forward and pay for that? And the answer is no one right now. So there you go.
Wow. So crazy. Dr. Jason Fung talks a little bit about this as well. You mentioned that a cancer cell is not necessarily evolving. It's actually, going backwards. Can you explain kind of how our cells work and what that process looks like and what kind of metabolism in a cancer cell versus like a normal healthy cell?
Well, Casey, right now, I'm sure you're breathing, right?
I am.
Are you breathing? You're not in a suspended state of animation. I'm sure you're breathing.
I feel like I'm breathing.
We're all breathing, right? Yeah, no, we're all breathing, right? Every time we take a breath of air into our body, that's the oxygen that's fueling energy metabolism through oxidative phosphorylation, okay? All of our cells are using, except erythrocytes, the blood cells that don't have any mitochondria or nuclei. I mean, all of the cells in our body are using predominantly oxidative phosphorylation. And to prove that in a very horrible and dramatic way, just drink Kool-Aid with cyanide in it, okay? This is what was it, Jonestown? Remember those
that's
people?
right. Yeah.
They drank the Kool-Aid with the cyanide in it.
That's right.
They're all dead in 15 minutes, right, or less. So because cyanide shuts off oxidative phosphorylation, and you die real quick. Your brain dies, all the cells in your body die real quick because you don't have energy. Without energy, nothing lives. Energy in the form of our lives is called ATP, adenosine triphosphate. Okay, so even the dogs are getting excited by what I'm saying.
They are.
So they can't live without oxygen either. So the oxygen is the final acceptor of electrons to form water in our body. So the urine that we develop, and this is all from energy metabolism. We exhale carbons from the foods that we eat, and we're all alive. Now listen to this. Cancer cells, you take cancer cells and you put them in a dish, and you put cyanide, they live fine in cyanide. So that means they're not using oxidative phosphorylation.
Wow.
They don't use oxidative. And if a person with a big tumor were to drink the Kool-Aid with the cyanide in it, the person would die real quick, but the tumor on his body wouldn't be dead.
Wow.
So there's the clue right there. So if the cancer cells are not using oxygen for their survival, what are they using to be alive? And it's the ancient fermentation. Fermentation is energy without oxygen, all right? Energy without oxygen. And what's the fuel for driving energy without oxygen? And it's glucose, the sugar, and the amino acid glutamine. So that's the clue right there. So if I pull the plug on glucose and glutamine, while transitioning the whole body over to ketone bodies, which can only be used by cells with good mitochondria, oxidative phosphorylation, thereby you metabolically marginalize and kill the tumor while enhancing the metabolic efficiency of the normal cells of the body. This is a very clear, easy, non-toxic plan for the management of cancer.
Wow. It's just, you're right. Like it sounds too simple to be true. You mentioned something earlier also that the insult to the tissue, the cause of cancer has to be chronic in nature. It's not just something that happens once very quickly. Is that correct?
Yeah, that's correct. It's primarily a chronic assault on the oxidative phosphorylation
Mm.
in a population of cells in a particular organ over time. A protracted, could be decades. It doesn't usually happen overnight. So for most cancers, don't start rapidly. They progress over time. When you say it's simple, I've encapsulated it that way. But to understand the molecular mechanisms behind what I just said requires quite a bit of detailed reading on the different papers that have been published over decades in the scientific literature. But when you understand what actually is the origin of cancer and how to manage it, then you can synthesize it down to seem incredibly simple. And you're right. It seems that way. And to be honest with you, it is that way. But for me to say that, it took a long time to put the pieces together in this cancer puzzle.
Sure.
We've made it out to be an incredibly complicated disease. Everybody has a different cancer. We have to use, that's all bullshit. They're all using the same metabolic problem. They're all using fermentation to stay alive. So that's the common thing of all cancers, whether it's a colon cancer, breast cancer, bladder cancer, brain cancer, lung cancer, they're all the same. They're all using the same fermentation mechanism to stay alive. And that's the shock to the system because then, why are we doing all these gene expression profile treatments to find your personalized? All that stuff is misunderstanding. You just pull the plug on the two fermentable fuels and you don't have to worry about what kind of gene mutations are in the tumor.
Mm. Yeah, definitely. That's a really good point. We don't want to say that we're oversimplifying anything, but it seems a lot more simple, maybe not easy, but simple more so than people make it. And this research is not new. I mean, 100 years ago, this was already being done and looked at, correct?
Yeah, well, Otto Warburg clearly defined the origin of cancer as a mitochondrial metabolic disease. The problem, he got himself into a little bit of trouble by claiming that some cancer cells, and maybe true, that they can still struggle a little bit with their oxidative phosphorylation. And then people equated oxygen consumption with oxidative phosphorylation. And we've now shown that's not connected. I don't want to get into the nitty gritties, but cancer cells breathe, they take in oxygen. They say, oh, look at the cancer cell. See, it's breathing like the normal cell. The problem is in the cancer cell, the oxygen they're taking in is not used for oxidative phosphorylation. And yet the mitochondria is still making ATP, which is the energy source. So anybody naively looking at a cancer cell will see Otto Warburg is wrong because those cancer cells are breathing just like normal cells. They're taking in oxygen and they're making ATP in the mitochondria. And that's true. The problem is they're not making ATP through oxidative phosphorylation. They're making it through glutamine fermentation. They're using it's amazing actually. So the amino acid glutamine, which is very abundant, is being fermented inside the mitochondria. The mitochondria are making ATP through glutamine fermentation, not oxidative phosphorylation. This is the key. This is the missing link in Otto Warburg's theory of cancer. Now we know this, and now it becomes very clear how to manage cancer and possibly resolve it.
Hmm. Well, you mentioned, glucose, and we are aware of ketogenic diets, and I know that I can eat a zero carbohydrate diet and I won't die. I know I can do that and provide a lot of my tissues with that alternate fuel that you mentioned, which is the ketones. But you also mentioned that the glutamine it's present, it's abundant, it's everywhere. What do we do about that? How do we stop the glutamine?
You have to drug it. You got to use drugs. And there are some drugs on the market or that have been known for years that target the glutamine pathway, the glutaminolysis pathway. The problem is you have to be strategic. You got to know what you're doing here. It's just, you got to know that same amino acid, which is driving the beast, is also essential for our gut health, our immune system, the urea cycle, and a variety of important metabolic pathways. So when you target glutamine with specific drugs, you have to do it in a pulsed way. And we published a big paper on the press pulse theory for managing cancer. So you can push glucose down, like you said, like you can really push glucose down really low as long as ketones are elevated to replace the glucose. Then once your patient's in therapeutic ketosis, we use specific drugs to target the glutamine, but just hitting it. We don't hammer it. we just interrupt it briefly for short periods of time while you're holding the noose around the glycolysis glucose pathway, and then you just gradually degrade the tumor out of existence, without causing significant toxicity or damage to the rest of the cells in the body. So, I mean, you got to know what you're doing. The problem is, unfortunately, what I just told you is not part of cancer metabolic practices anywhere.
Nowhere. Is this, I mean, being looked at? Is anybody,
No.
any?
Yeah, no, the pharmaceutical industry is well aware of the role of glutamine in cancer. They are struggling massively to find a patentable glutamine targeting drug that we already know Don 6-deoxynorlucine can do. Don is the best right now. I haven't seen anything better than that drug. But the pharmaceutical industries would like to find another drug like that, and therefore they can patent it. And the problem with those guys, and I know this because I see that they're doing this all the time. They only want to use that one drug on the patients. They don't want to target glucose at the same time. And I asked them, why you can't win the cancer battle if you're going to only close one door. There's two doors, the glucose door and the amino acid glutamine door. Oh, but they said to me, but then we won't know if our drug is really effective if we. Well, then I said, you're not going to cure the patient. They're interested to know if it has an effect. It's absurd. I said, what do you want to do? You want to patent the drug and make a lot of money, or you want to cure the patient? Oh, well, you know what the answer to that is. So we published a big paper and we said, you're not going to win the battle against cancer unless you target glucose and glutamine simultaneously. Now, do you hear what I'm saying? It's called simultaneously. That means you got to shut the front door and the back door together. The cancer cell is checkmated and they will be eliminated from the body and purged from the body. Patients will recover.
Wow.
But no one's doing that. I mean, they're not doing that.
And the reason for that is, like so many other things in our system, it's because of money. They're not making as much money.
Well, I wouldn't say it's not making as much money. To patent a drug and have it, you have to demonstrate therapeutic efficacy. And you have to, but here's the situation. If you use the glutamine targeting drugs by themselves, you will get some therapeutic efficacy in all likelihood, but you have to pound the drug. And that causes a lot of excess toxicity and doesn't do or anything or very little to the glucose pathway. But don't forget, listen carefully. Almost all of the major drugs that have been FDA approved have only given 2.4 months of extra survival. So if a company comes along with a glutamine targeting drug that can get 2.5 months of survival, they'll consider that a major success. I don't consider that a success. I want 7 years of survival. I want resolution. Okay, and believe me, we can get long-term survival if we can target glucose and glutamine simultaneously. It's the system itself, the system that's present in the pharmaceutical and medical industry prevents us from getting to the promised land with this cancer. So it's not so much the understanding of the science is there, the evidence is there. It's just policy and situations and these kinds of things that are preventing us from doing this.
Gotcha. Interesting. So while we're waiting for some of these drugs to be pushed through, hopefully they will be at some point once the trials are done, can a ketogenic diet alone be helpful, or do you really have to close both of those doors at the same time?
Well, we're working with a case right now of a brain cancer person who just used self-administered ketogenic metabolic therapy alone, who's now survived over 6.5 years with glioblastoma, which is astonishing.
Wow, that is.
But at the same time, that person got a sporadic mutation called IDH1 mutation. It's been known for a long time that this mutation, it happens spontaneous, like a gift from God. People who acquire that mutation in the growth of their tumor, it just happens by chance, live longer. They can live twice as long if their tumor, for whatever reason, gets this mutation. It slows down can you believe this? The mutation slows down the glucose and glutamine pathways. And then you combine that with ketogenic diet, you can live a hell of a lot longer. But not everybody is fortunate enough to get that mutation in their tumors.
Wow.
So people who this guy that we're working with now, I mean, he's out 6.5 years. I mean, he should have been dead in 12 months. He had no radiation, no chemo, nothing, just the metabolic therapy. And his tumor happens to have that mutation. And therefore, the mutation together with the diet therapy are holding his tumor in check. It doesn't grow, so he's fortunate to have that.
Wow.
So, but the problem is that, not everybody is going to get that gift. And so therefore you have to come in with the drug that does what the gene mutation did. So this is just the reverse of what the pharmaceutical industry is doing. They're trying to target genes that are supposed to cause the tumor to grow faster. But some tumors get genes that cause them to grow slower. You don't want to target those. You don't want to target those things. That's like, as I said, it's a gift from God. So, but people in brain cancer, they need to know that, so then they can make very strategic changes in how they might want to manage their disease.
Interesting. The case study that you just mentioned, that's a very lethal cancer that you're right. Like 12 months is a gift on that, that diagnosis.
Yeah. Well, you look at, younger people live a little bit longer. If you, and you consider the president's son, Beau Biden, who was diagnosed with that same cancer, and he survived 21 months after diagnosis. Whereas U.S. Senator John McCain, who had the same cancer, he was older at diagnosis. He was 80, and he lived only 13 months with glioblastoma. Whereas our guy, he's out 77 months. Okay, so he never took. See, those other two folks, they took the standard of care, which is rapid debulking followed by radiotherapy followed by toxic poison called temozolomide. It's a chemotherapy, and sometimes they give these dexamethasone. It's a steroid to reduce the swelling and edema from the radiation therapy. That's the standard of care, basically. And the guy that we're working with avoided all of that stuff. He didn't want. He saw the writing on the wall. Those people don't survive. I mean, you can look at survival for glioblastoma after 3 years. It's extremely low. 4 years, it's 5, 6, 7 years. It's like it's almost non-existent. And yet our guy is out 6.5 years. So because he avoided a lot of things that provoke the tumor to grow faster. He lucked out by having that one mutation, and he embraced. And when you do ketogenic metabolic therapy, we publish the glucose ketone index calculator, which allows everybody to know whether the degree of therapeutic ketosis that they're in. So when the ratio of ketone bodies and in the blood and glucose in the blood is a 1-to-1, a 1.0 or below, that means ketones are higher than glucose. I mean, you're going to rain hell down on that tumor cell, those tumors in your body. So that's the biomarker for cancer patients to know whether they're in therapeutic ketosis. Once they're in therapeutic ketosis, then we come in with drugs and procedures that will degrade slowly the tumor. And many people emerge from this in a healthier state, far healthier than they were when they started.
Interesting. So that was going to be my question on the case study. Like if we're buying some people, 70-ish more days, we talk about a lifespan and an expanded lifespan, but who cares if your health span is not great? Like what's this guy's experience in life? Is he suffering, not a great life experience? Like what is his life like?
Yeah, his life is quite good. I mean, he does have breakthrough seizures from the surgery and things, like a lot of anybody who would have brain surgery, many people with brain surgery, regardless of what kind of brain surgery you might have. And he had the tumor debulked 3 years after he was diagnosed. So he did have it taken out, but it was 3 years, not immediately. He has some seizures, but his quality of life is great. I mean, he got married as a child. He's living a life that is not so debilitating. Okay. It's not like he's suffering. Of course, like some people would say, well, if I have to keep myself in ketosis, he's adapted his body to this. And I've spoken to him, and I met him and I talked to him and he's happy. He has a little baby. He's doing, I mean, he's not going to go out to the bar and pound big beers and things like this, but because he's enjoying his life. He's not suffering like you would see, there was no vomiting, diet. And this is another amazing thing, when you get these chemo therapies or immunotherapies and all these kinds of things, your body gets like beat up. not all people. I don't want to say everybody who gets an immunotherapy is going to be sick as a dog. But they do. If you hear the notes on TV every night, Opdivo, your Keytruda, your all these different names they have for these things. You can have this side of it, it can kill you. Listen, the metabolic therapy will never kill anybody, as far as I can see. But those other therapies could possibly kill you or make you massively sick, like you mentioned at the beginning of this interview. Mm. You have seen the effects of what these things do. I have seen it. People come to me and they say, "Oh, can you help me? I went through the whole system. My cancer's still growing." They look like death warmed over, right? Mm-hmm. I mean, I don't know if metabolic therapy can rescue people within a few weeks of their life. I mean, you can. You remember Tammy Faye Baker? You can go on the web and you can look at pictures of her when she was, healthy, and then at the very end, I mean, she was, horrifically beat up by the system, by the cancer and the treatments. I mean, people know what you look like when you get at the end from being poisoned and irradiated. I mean, your body is just, why you take a sick person and you subject them to such toxic therapy when you don't have to do that? I mean, why are you doing radiation and chemo in the first place? Well, we got to stop the proliferating cells. Well, yeah, but if they don't have energy, they're not going to grow. They're going to up and die. So you just pull the plug on their energy and they'll die just as fine. And you keep the rest of the body healthy. So why are you doing what you're doing?
Wow.
And these are the big questions. And you go to any oncology group anywhere, you're at Utah, right? Go down to the medical school at the University of Utah and say, yeah, you guys do metabolic therapy? They're going to say, what's that? And most of them are not even going to know about it. Well, you say, why? Well, don't they read the scientific literature? Well, there's no clinical trial. They always throw like robot, rather than say, if the pharmaceutical company came along with what we can do with metabolic therapy, it'd be a worldwide joy as the result of this. But, it's just, we're just not there yet. Not enough people know about it.
Wow.
And even the medical establishment doesn't even know about it.
And it's like you mentioned, like, and what if it doesn't work, but like just the benefits of being in ketosis on a ketogenic diet? Like, why would you not want to drop your blood pressure or lose some weight or, improve your insulin sensitivity? Like,
well, because people have faith in the medical system and they should. I mean, some parts of the medical field have made massive advances, like in knee replacements, hip replacements, heart disease, valve replacements. I mean, there have been miraculous advances, but the cancer is still in the Stone Age, and it's going to overtake heart disease in the next couple of years. So if it hasn't already, in China, there's 8,100 people a day dying in China from cancer. Obviously, they have a much larger population of people, but it's the number one killer of people in China is cancer. And you say to yourself, why have we made all these other advances in medicine, like you alluded to at the beginning of the interview, but yet cancer is still wallowing in a lack of knowledge and in procedures that harm you as much as they could possibly help you. I mean, it's just because you have a misunderstanding of the origin of the disease. It's a mitochondrial metabolic disease. It's not a genetic disease, okay? And that's the key. So if you don't understand the origin of the disease and you build therapies based on something that's not the origin, you're going to get drugs and therapies that do not work effectively, period.
Wow. That's crazy. You've talked about this before, and I know you've been challenged on this, but I think it's so fascinating. It sure makes a lot of sense to me that the needle biopsy. Tell me a little about how we even know that something is cancer or not, and what potential harms that could have.
Well, I think, it's been there's dozens of papers in the scientific literature showing that needle biopsy can increase risk for spreading cancer around the body. But why are we doing that? And a lot of it is doing for histological diagnosis, looking at the number of proliferating cells. And then, of course, they take the tissue and they do gene expression profiles to tell you what kind of gene mutations you might have in the tissue, which is largely irrelevant anyway. You don't care. If you can kill the tumor cell without knowing what the gene mutations are, what difference does it make what the gene mutations are? Largely irrelevant. So we look at it. So you stick the tumor with a needle and you create an inflammation in and around the tumor, which then brings in cells of our immune system called macrophages. And macrophages are known to be highly fusogenic. And we and others have shown that these macrophages can become destabilized metabolically in trying to heal the wound from the needle biopsy. And they are the origin of the metastatic cells that spread through your body. It's the metastatic cancer cell that ultimately is responsible for the spread of the disease around the body is one of our immune system cells. It's a natural cell of our immune system. And when that cell becomes corrupted metabolically, it grows out of control and simply spreads around your body. And you don't want that. You want to try to avoid producing cells that have the capacity to kill you, right? Nobody wants that. So then you have to reevaluate why are we taking a biopsy to determine whether or not. So if the tumor is benign, why would you want to take a biopsy of it in the first place? If the tumor or the lump or whatever you're looking at is malignant, you never, ever want to stick it with something. So you put those two together. So you say, well, how can we analyze it? Well, we have non-invasive procedures. You have PET scan, MRI, you have these kinds of things. So what you do is you throw yourself into a metabolic therapy. You then target glutamine. Now here's what happens. The tumor could completely disappear. You don't have to do anything. It could become really, really small, in which case you could come in and debulk it completely with a small surgical procedure. Or you can make further decisions, depending on how the press pulse metabolic therapy works on this. So it's a different mindset. It's a completely different mindset. You want to manage the disease with not harming the patient in any way. You don't want to put that patient at risk. So you can give a gene expression profile, which is largely irrelevant, and put that patient at risk for spreading the cancer. Then the patient says, now it's in my lymph nodes, now it's in my liver, my lung, or wherever. And you say, what the hell happened here? How did that happen? Well, you stuck it, Now, I'm not saying that happens to every patient. If it's not common, let's put it this way, it's not common that would happen. But I can tell you, there are a number of scientific publications for various cancers: breast cancer, prostate cancer, colon cancer, liver cancer. All these cancers have been known to be provoked by biopsies, all right? So there's you want to avoid, I would never have a biopsy. I just shrink it down if I had it, if I were to get it. So you got to know what to do. Now, the problem is the poor folks that have cancer, they don't feel good. They have a spot of blood. They got a lump. They got a blah, blah. And they go down and they get a diagnosis. And then they start being poked and prodded. And the next thing you know, you're in a condition. And where are they going to go, right? They got to go to their top medical school to get the issue here is that the guys on the front line have to use, very, very gentle in making a decision about this process. Initiate metabolic therapy, see if it responds. You don't have to poke and prod it at all. What happens if you do metabolic therapy and it disappears? You don't have to do anything, right?
Wow.
So, or once it's shrunk, the surgeon can pluck it out, right? Why women have to have their breasts removed? This is absurd. It's already shown that mastectomies don't increase overall survival at all versus a lumpectomy. So this is already known. Yet people do this radical mastectomies. They're still doing it despite the scientific evidence that says it doesn't do anything. People don't read the literature. This is the problem. Okay, so one of the things I do in my class, in my classes, where our job is to increase scientific literacy. Okay, people need to be scientifically literate, right? It's just part of the staying alive in today's society.
I agree.
You got it. And we saw that last year and all the stuff with the COVID, how scientific illiteracy can create a pandemic far worse than it needs to be.
Yep.
All right. It's clear. And the same thing exists in the cancer field.
Wow. Yeah, it's just mind blowing. So to contrast, kind of what you're talking about. So there's a tumor that's growing at a place where there has been chronic damage, inflammation of some kind. So it's already inflamed. You go in, you poke it, that increases the inflammation in that area. And then the first step after that, usually I believe, if I'm not mistaken, within a few days, you're going in and trying to cut out that entire area. Do I have that correct?
Yeah, I think that's if you have a lesion in the colon and you find that it's there, they'll take a section of your colon out, right? They'll take a lump out of your breast or remove the whole breast completely, or take a chunk. You're going to do what we call surgical mutilation, which is curative. If you have a tumor that has not yet spread around your body, surgery will cure it. And as a matter of fact, if it's a tiny little lump, a beam of radiation could burn it out. The only problem with the radiation is you put some of your local cells at risk for later on developing a cancer. So you always have to put that. That's why oftentimes older people, really old guys like in their 80s or something, they might be given radiation therapy because they're probably not going to live long enough to get another tumor from the radiation they gave them. But they make a decision. But why do that when you don't need to do that? Unless the patient demands it. Now, you can't stop that. There are some patients that want to be irradiated. There are some patients that want to take toxic chemicals, and there's nothing you can do to. I mean, I'm not saying if a patient really wants to be irradiated and take toxic poison that we shouldn't prevent him from doing that. I mean, if that's what his desire is. But I think many people would like to know that there is an alternative to what we call standards of care. So the inflammation. In metabolic therapy, we reduce that inflammation substantially. We put the fire out. Inflammation is fire. It's tissue fire. You put the fire out metabolically, and then when you come in and debulk the tumor, you're going to be a greater probability of getting all the cancer cells during the resection or debulking procedure. In which case, you are essentially cured. You really don't have to worry about that cancer coming back. But if it's not all, it's like the bee, if you're going to go and get rid of the hive of wasps that is hanging from the tree, you don't go up to it and hit it with a baseball bat and then try to beat each individual wasp as it's biting the hell out of you, right? I mean, you go out at night and you spray it with some spray, and the next thing you know, you kill them all together in the hive. You don't want them spreading out and to get you. So the same thing with metabolic therapy. We shrink the tumor down, reduce the inflammation, make it very less angry, and then go in and debulk it out if it's still there. So the strategies that we're talking about make perfect sense if you understand the biology of the disease.
Wow. I love that analogy of the bees. I'm going to steal that one. That's really well done. So generally speaking, this is probably a difficult question to answer because it's so specific, but generally speaking, if you had to eliminate one of the two, which do you find more harmful? Do you find in general radiation more harmful or chemotherapy more harmful?
Well, I don't think either of them is really healthy. Right? I mean, let's be honest. How many people are running down to say I need to get I just want to see what it feels like to have a part of my body irradiated. I mean, what it does is it causes systemic inflammation. And how do we know that? Well, people who are irradiated, their C-reactive protein goes up in their bloodstream. C-reactive protein is a marker for systemic inflammation. So, I mean, cancer. Why you want to create systemic inflammation in anyone with cancer? You want to do just the opposite. And chemicals. Wow, you ever see what these chemicals do to your body?
Yes.
When you see someone walking around with a bald head, you say, "Oh, he's undergoing cancer treatment." Why your hair falls out when you're trying to stop? I always look at somebody with a bald head as somebody who is abused by someone who is clueless as the biology of the very disease they're treating. Wow. Because you're giving them a poisonous chemical to stop cell proliferation, and cell proliferation out of control is cancer. So you give them a chemical to stop cell proliferation. But if they can't get glucose and glutamine, they're going to die anyway. Without ATP, nothing lives, right? The cancer cells are completely dependent on fermentation metabolism. Target that, you get rid of it, and you don't have to lose your hair, bleed from orifices, and look like death warmed over. So, right? Why are you doing that? And what I'm saying is like, Harris, okay, why don't you try what I'm saying? Why don't you see what's going to happen when you do this? And then look at your buddies who are taking standard of care. Now, don't get me wrong. Standard of care has saved the lives of tens of thousands of cancer patients. And we have a huge group we call cancer survivors, right? You always see them marching, marching cancer survivors. Well, don't forget, there's a new field of medicine that's opening up around the country called cancer survivor medicine. So after your body has been brutalized by radiation and chemo and immunotherapies and whatever else you're going to do to these poor folks, now you have neuropsychiatric problems, you got hormonal imbalances, you got digestive problems, bone development problems, you got every other kind of a problem you never had but for the fact that you were poisoned and irradiated, right? So now you're a new patient for a new form of medical care, cancer survivor medicine. And, and oftentimes you don't live on the planet as long as people that weren't treated with toxic therapies. So, I mean, this whole thing is just an escalating situation of problems. And once you know the biology of the problem, like we do, and once you have, we can transform the entire cancer industry over to a less toxic strategy for managing the disease and keeping people healthy. Oh, by the way, if you had diabetes, that'll go away. You might have, cardiovascular, that'll go away. High blood pressure will go away. Macular degeneration. You can get rid of a whole slug of other chronic diseases. At the same time, you're getting rid of your tumor. Now that is probably not what people.
Wow. It's just
right?
so powerful. It's so powerful. It's crazy.
Yeah, it is. It's crazy, and you can only appreciate it if you understand the biology. If people are scientifically illiterate, then you're not going to understand any of this stuff. Wow. So it's just that simple.
What about the role of fasting? I hear this a lot with cancer and fasting. Can fasting be beneficial? Is the first part of the question. Second part is fasting beneficial only because it puts most people in a very ketogenic state?
Well, it's a combination of both. Fasting, we know that water-only fasting has a great therapeutic benefit, not only for the body, but also targeting and killing cancer cells. If I were to come out and say, oh, you want to get rid of your cancer, stop eating for 3 weeks. Well, they'll look at you like you're some crazy guy, right? And that's why we say ketogenic metabolic therapy, because you can get into the same therapeutic state as water-only therapeutic fasting. The problem is going cold turkey on water-only therapeutic fasting is extremely tough for most people, especially older people. I work with young kids in the university level, and you take me. I tried it, and it's a bitch. It's not easy to stop eating and wait for your body to get into ketosis. I mean, but if you go from zero carbohydrate diet slowly for a few weeks and then go to water only fasting, the transition is much easier. But you're absolutely right. I mean, there's a guy on the web, you can look him up. His name is Guy Tannenbaum. He had advanced prostate cancer to his bones and his lymph nodes and different organs. And he went on these really long water-only fasts for maybe 14 to 20 days, and then onto a keto for 14 or 20 days, back on water-only fasting. And his cancer is completely gone. He's on the web. He's working with some people documenting everything that he has done. Now, he had type 2 diabetes. He had a touch of Parkinson's disease, besides having advanced metastatic prostate cancer. And his diabetes is gone. The guy lost, he went from 235 pounds down to 165 pounds. He looks very, very healthy. He doesn't have any trace of cancer. His diabetes is gone, and his hand now shakes very minimally. So he got rid of all these other maladies. At the same time, he got rid of his cancer. And he did primarily water-only therapeutic fasting, intermittent with low glycemic diet. So yeah, it can be done. Is it easy? No, it's not easy. It's probably a hell of a lot easier to sit in a lounge chair and have your body infused with toxic chemicals than doing what Guy Tannenbaum did. But Guy is the image of spitting health today. I mean, you can look at him. You can look at him up. Guy Tannenbaum on the web. He's got all these different, and he goes through. He's got a very thick French accent. He tells you what he's done. But you can look at these kinds of people. They're out there. They're doing this, but they're marginalized. They're not really considered important for overall cancer management.
Wow. That's so interesting. I have to say, I'm really glad you made the point of, first transitioning onto a ketogenic lower carbohydrate diet before trying fasting. I have absolutely noticed the same thing, even in things as simple as like weight loss. It's very difficult if you're eating a lot of carbohydrates to fast, because your blood sugar is going to crash and you're going to be very hungry and hangry, and fasting is not going to be a viable option for you. It's not going to work.
No, I tell you, it's hard.
Yeah,
very hard. I tried it. It's hard. It's terrible. I mean, it's like, but you can transition to that. As you said, the other thing too that's extremely important is to use the glucose ketone index calculator that we developed here at Boston College to know if you are in fact in therapeutic ketosis. This is important because people say, well, I've done all this and I've done all that, and I'm peeing on the strip and it says I'm in ketosis. Likely you are, but the calculator gives you the exact quantitative number based on, now you have to take a little pinprick on your finger, like you're measuring for people with diabetes. They do this all the time. And you can get the number, on the Amazon, you can buy the glucose ketone index meters. They've got the Keto Mojo, the Precision Extra. There was a paper that was published not long ago showing that Keto Mojo and Precision Extra are very accurate. And they give you similar information. You can buy all that stuff on Amazon. That's where we get it. And then people can measure, quantitate it. You can actually quantitate your degree of therapeutic ketosis. 1.0 and below, the glucose ketone index will put you in good therapeutic ketosis. Now, here's the interesting thing. Healthy guys like yourself and others, it doesn't take too much energy or effort to get into a good therapeutic ketosis. But the cancer patients, man, it's tough. After they've been treated with toxic chemicals and radiation and all this other stuff, they have a very, very difficult time getting into the therapeutic zone for cancer management. It seems as though all that stuff prevents the GKI. And this is another thing. The standard of care for cancer prevents you from makes getting into the zone much, much more difficult. So people need to know that.
Mm. Wow, that's a great tool. We'll make sure that we link to that in the notes. Before we leave the fasting thing, I just want to make one more point. We would do metabolic assessments on our clients and show them, based on their oxygen intake and carbon dioxide exhalations, we'd show them, where they're burning fat the best, where they're burning more sugar. And we would have a page that would show the stored fuels you had in the body. And it would show, for most people, the number of calories you have of glucose is extremely limited, 1,500, 2,000 right in there. But then we'd show people based on their weight and their body fat percentage, how many calories of fat energy is already present and on the body. And it's, for most people, hundreds and thousands of calories. And that's what fasting can do. Once you get better at fasting, it just allows you to access that fuel that's already there that most people don't like anyway, and you burn it off.
Yeah, and the cancer cells can't use it.
Wow.
You got to recognize that they can't burn fats or ketones.
That's right.
So they're stuck on that. They're linked to the glucose and the glutamine. So they get hammered. And you're reducing the inflammation. You're doing everything that the cancer cell can't survive in.
It's incredible. It's incredible.
Yeah, and you can prevent cancer. So if you get cancer because your mitochondria are damaged in the cells. So if you keep your mitochondria healthy, it's almost impossible to get cancer.
Wow.
Let me give you an example. I always use this example and write about it. The chimpanzees, right? I mean, they're our closest biological relative. They're 98% similar in protein and gene sequence to us, right? There's the cancer is rare, so rare in chimps. In fact, there's never been a documented case of breast cancer in a female chimpanzee, right? And they're under constant scrutiny all over the world in these zoos. The vets are always looking at these chimps, and they never see cancer. And the chimp is eating a diet that it essentially evolved to eat. So don't forget, humans and chimps evolved from a common ancestor. The chimp and us have the common ancestor. The chimps have maintained the diet and lifestyle that they had when they first emerged as a species. Us, on the other hand, because of our tremendous intellect, we've put ourselves in diet and lifestyles that are very, very different from when we originated as a species. And that diet and lifestyle has created environments that put us at significant risk for all kinds of cancers. So clearly, diet and lifestyle is probably the single largest origin of cancer because we put our mitochondria at risk. And in the case of the chimp, they're not doing that. They're not putting themselves at risk. Now, obviously, no one wants to do the control experiment, which is take a bunch of chimps and raise them from early ages in the same diet and lifestyle that we have, right? So, raise them with Dunkin' Donuts, big pizzas, Coca-Cola, all the different kinds of things that, sweet cereals and, all the different things that we eat, processed meats, processed foods. I guarantee you those chimps are going to have the same problems that we have. They're going to be obese. They're going to have type 2 diabetes, cancer. They're going to have all the same things that we have. right? Now they probably would enjoy that lifestyle more than just eating a bunch of leaves and whatever they eat, raw monkey flesh and that kind of stuff. I mean, but let's be honest, it's diet and lifestyle, baby. That's what's causing the problem, and it's a tough thing to change, especially when it's so enjoyable to participate in these things.
Wow. Yeah, yeah, maybe it's tough to change, but it's really not all that tough. And the upsides of all of this is so great. And I love that you brought up the prevention piece. And man, you can go enjoy your life. You can go have a fun, energetic life free of chronic disease for the most part. And once you get used to it, it's really not that bad. It's not very difficult at all. And you'll probably continue doing it because you like how you feel.
No, I think it's difficult for the majority of people. I mean, these guys are, working hard. They go home, they want to drink beer, wine, or have a couple of shots. I mean, you go to the bar. Bars are a place for social interaction, enjoyment. And, you're drinking beer and wine and whiskey. People like doing that, right? If you want to maintain a pristine life, you have to cut back on that. A lot of people aren't willing to do that. They're going to roll the dice and hope that they don't damage them. However, if they know, like what you're saying, if they know that they can periodically fast and recover the health and vitality of their mitochondria, they might be able to participate in both worlds. So you can't become a nut about this stuff. You just have to be aware of the risks, and each person has their own knowledge base, and they'll address those issues as long as they know about it and know what they can or should not do. That's, I think, is the best. Because I'm not telling anybody that they need to change their diet and lifestyle. It's not my job. My job is just to show you how cancer starts and how you can get rid of it, and how you can prevent it. But, it's up to everybody to, at least if you have knowledge and awareness, you can make choices in your life. And that's basically the best thing.
Yeah, that's great. That's really empowering. And it's like you said, you didn't say eliminate 100%. I like all of those things. I like being social and have a drink every now and again, but you just don't do it all the time. It's not worth it doing it all the time.
That's called, self-discipline, yep, which is a shortage for a lot of people, especially in COVID, right? They're all sitting home, they're pounding the wine and the whiskey. It's just, it's tough right now, but I think that, just being aware of these things can possibly, make a little bit of a difference in your life.
I agree. Well, this has been an amazing conversation. What is one simple thing you would want the listener to take away from this conversation and plug into their life with benefit?
Well, if people want to contribute to our research program, which is also, we get a lot of nice support from folks for a variety of reasons. The program, Travis Christofferson wrote a book, Tripping Over the Truth, the rise of the metabolic theory of cancer. He has a private foundation called the Foundation for Metabolic Therapies for Cancer. And we get a significant amount of our funds from his private foundation, along with the goodwill of other folks. But that keeps us going. We need when we do our preclinical testing on our animal models, which are the best there is for managing cancer, for knowing the origin of cancer, and we get really good success rates. We immediately tell my clinician friends to put it on patients, and the patients are doing so much better. And that keeps the program going. So the more we understand and facilitate this whole system, the faster we're going to get all this into the population, and people are going to benefit massively from that. But it does take money. It takes funds to continue to test and tweak the system and look for better improvements in the system, better drugs, less toxic drugs, dosage, timing, and scheduling. All of that is so important to eventually develop a protocol that will be applicable to the majority of people with all kinds of cancers.
That seems like a better thing to invest in than signing up for another local 5K in awareness of such and such version of cancer. Yeah. You probably better give the money to you. Where should people go to find your work?
Well, I publish a lot of my work open access. So that means you just look for my name and go into the PubMed, or even just put Seyfried Publications. I got a lot of YouTube videos, just put my name, Thomas N. Seyfried, papers. You're going to see them all. So they're open access, which means everybody, lay people, anybody can read them. Now, you're going to read them. A lot of people say, woo, it's just, so over my head. And some of them are, but some of them aren't. So you're just going to have to wade through them and find the ones that you can understand. And it's an educational experience. If you want to keep your ass alive and you want to look at the things that can help you, some people, they start getting out the biology books and the biochemistry books, and they try to wade through it as best they can. But I find that the majority of people are smart, and they put a little effort into it, and they get enjoyment out of reading some of these things. So,
yeah.
The glucose ketone index calculator, they like doing that. I find that more people that don't have cancer and they're very healthy, they like to see how their glucose ketone index is doing metabolic therapy, fasting, and that kind of stuff. And it makes them feel good to know that they have a quantitative number that gives them the empowerment to know that they've actually hit the key zones of therapeutic ketosis.
Wow. Well, it is very empowering, and we're so grateful for you and for your work. Dr. Thomas Seyfried, thank you so much for everything that you do, and thank you for coming on our show today. We really appreciate it.
Well, thank you, Casey. It's a pleasure to be here today.